Good morning and welcome to another episode of Breakfast with Bacon. I'm Claire Bacon and I'm here with my husband, Dr. Bob Bacon. So I understand you have something to tell us today?
Yeah, actually, it happened yesterday. We had a guy come into the office, a client of mine who's been seeing us for a very long time, doing nutrition with both of us and doing chiropractic for a while, and asked me, he said he's getting ready to go on a trip to go visit his family in a different place in Kentucky, and they're all flying in. He goes, I think I was going to get the flu vaccine, and I wanted to get some insight on it. And I talked to him about the flu vaccine. I'll go over it really quickly. What I said to him, I said, you have mucous membranes in your mouth, your nose, your eyes, where all those viruses and bacteria and germs will go in, and your body has its own natural defense mechanisms to deal with them. However, when we take a vaccine, we get it directly injected into our bloodstream, which bypasses all the normal and natural body's ability to fight it. So I explained to him, listen, I would do some things to help support your immune system, help your detoxification, and we left it at that. Totally his choice to follow through with it. Walked him to the front of the office. He was checking out with Tracy, and then in comes the next guy, our next client, and walks in and goes, Doc, I'm in a big hurry. I said, yeah, what do we got to do? He said, well, my brother just got the flu vaccine. He's in ICU. He's on morphine. He's got real bad leg pain. His arms are hurting. He's aching, and he can't get out. And I said, stop real quick. And I grabbed the guy who just walked out, and I said, listen to this story really fast. And he explained it to him. To me, that's how amazing this practice works. I don't think the guy who walked in is going to run out and get the vaccine unless he does some things to help support it. Because what I want you guys to get as a takeaway from this, please ask your doctors, what are some of the risks? What are the benefits of taking it? Name 4 things that's actually in the shot that is going to go into my body and help support me. Because some of them are actually known carcinogens like
Formaldehyde.
Yes.
Would be one.
Yeah.
There's also thimerosal, not in all of them, but in some of them, which contains mercury, a known neurotoxin.
Mm-hmm.
Some of the flu shots have actually been tested and found to contain glyphosate.
Right.
So that's the ingredient in Roundup.
Yeah.
And then of course all of them are going to contain some form of an antibiotic to prevent bacterial buildup, things like that. So there are some items of concern, and it's good to have a sense of confidence that you're doing things to support your immune system and detoxification so your body can deal with these ingredients that are also contained.
Perfect. That's exactly what we talked about. So, and give them a couple of resources.
Okay. So I always like to recommend nvic.org as a good source for information, and also vaxcalc.org.
Yeah, and we're also here to if you guys really appreciate this information, you can always ask us at drbobbacon.com. We'll help you guys out. We're also doing this every week to just kind of get information out to you. Hopefully you guys like enjoying this, and if you do, you can always like it and send this to friends. But we appreciate you guys tuning in, and we look forward to talking to you guys next week. Thanks.